Hey everybody, so I finally decided to make a second video. Those of you that watched my first video know that I was diagnosed with POTS syndrome back in August, I guess. Somewhere August, September, something like that. The reason that I haven't made a second video for the last 4 or 5 months is actually because POTS in itself, most of the time, is a secondary syndrome. And POTS in itself is not really a type of disease. It's more or less it's caused by an underlying factor. And the issue that people run into is the autonomic nervous system, I guess, is not well understood. So sometimes it's challenging for any doctor to find what's got it out of whack. When I went and seen a cardiologist and a neurologist for the POTS, he had basically told me, look, you know, with this, most people are told sodium load, and they are given a beta blocker. And in my case, that wasn't possible. My blood pressure was like 145 over 85 or 90, which is like borderline high, but my heart rate was like 32. So I couldn't be out here eating 3,000 to 5,000 milligrams of sodium a day, and on a beta blocker, if my heart rate would have been any lower, I would have died. So he pretty much told me, wear some compression stockings and good luck. And I mean, it was getting to the point to where I literally, at the first of all this, it was more a panic. I don't know that the morning that I woke up July 18th and the first morning that I went to the hospital, if the POTS thing was there, I suspect that it was. I didn't even realize that the heart rate change was going on until about 2 or 3 months into me being sick. The first two or three months really was panic attacks. My face was going numb. I felt like I was going to pass out. My heart was racing. Numbness and tingling on my feet. The palms of my hands burning. My face going numb. And I finally, like I said in the first video, they had put me on medication for my anxiety, and I tested a couple different medications until I was put on Wellbutrin, which I've been on for about 4 or 5 months, and it really helped me a whole lot. And about a month into being on the Wellbutrin, I finally calmed down enough that my wife and I were sitting on the couch one day, and I just stood up, and it almost felt like someone had a chain. This is gonna sound crazy. It felt like someone had a rope or a chain tied to my brain, and every time I would stand up, they were just tugging on it and pulling me back down, and I would get lightheaded and dizzy. And then she had a blood pressure monitor here at the house, so I walked over and not to check my blood pressure, but my heart rate. You know, every time I'd stand up, I could feel my heart just going crazy. So I went over and I sat down at the kitchen table and checked my blood pressure, and it was like 122 over 80, and my heart rate was like 55 or 60, which 50 is usually what I run my entire life. It's been about 50. So that's not too bad, you know. And I stand up and I check it immediately after, and my heart rate was like 135. Sat back down, checked it again, heart rate's 55. Stand back up, 130. Sit back down, 55. I mean, literally just like boom, boom, boom. So I was like, honey, come over here and look at this. And she checked it out. And by that time, I'd already had the stress test and the EKG and the echoes and the Holter monitor, and they were like, no, everything's good, you know, like you're fine. I went back to the doctor and just showed him. I sat down, stood up with a pulsometer on my finger, and he's like, dude, you got the POTS. So dial it back. I made the video. Pretty much at that time, I was going to the ER literally 3 times a week. I was missing work, and I'm 24 years old. I just had my son about 2 weeks before I got sick. We just bought a house. I've got a federal job. We got all these bills. We got 2 new vehicles. Like, I had to work, and it was literally, I couldn't get off the couch, take a shower, and put my clothes on without laying down because I was gonna pass out. Like, I was bad shape. Couldn't walk up down my stairs. So I was like frantically searching everything. So I bounced around to probably 5 or 6 different ERs and had been to each one 15 to 20 times in a 5-month span. And actually, I had avoided Three Rivers Hospital in Louisa at all costs. Like, at all costs, I'd avoided it because my entire life I've heard nothing but terrible things about it. But one night, it had got to the point that last month I was literally going to the hospital just to try to get IV fluids. And I thought, what the hell, if it gives a shit how good the hospital is, they definitely have IV fluids, so let's go try that out. So I go, and I'm laying down in the bed, and he's giving me my fluids, and my heart rate monitor's constantly ding, 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 because my heart rate's 33 or 34 while I'm lying down. And I roll over in the bed, and I guess that they can see your heart rate from the nurse's station, because the doctor busted in the door, and he was like, "Are you okay?" And I was like, "Man, I'm fucked up for real." He's like, "Dude, I'm telling you, your heart is doing something I've never seen anybody do." He's like, "You're laying down, and then my room was right in front of the nurse's station." He said, "We watched you roll over, and your heart rate jumped to 110. And I was like, "Well, I do have the POTS diagnosis." And he's like, "You don't have a clue what caused it?" And I said, "No, man, So he starts rattling these things off, and he's like, "Your body can have a certain reaction to cancer. Do you have cancer?" And I was like, "I hope not. I don't think I have cancer." And he's like, "Have you been in any car accidents?" I said, "No." "Surgeries?" "No." He's like, "Man, you got to think about it. Something caused it." And I don't know why I didn't think about this sooner. But about 6 weeks before all this started, Katie and I had went to Red River Gorge for some paternity pictures. And we went down this little path and was in the creek and had our pant legs rolled up and our shoes off taking pictures. And about 3 or 4 days after that, I'd got home from work one day and noticed a spot on my leg. It was about this big around. It wasn't a bullseye. It was red, it was pretty red. But never found a bug. I just thought we just moved in the house probably 6 weeks before that. And we had been at the gorge. I just thought, well, shoot, a spider's got a hold of me pretty good. And I'm like most guys, I don't go to the doctor. I hadn't had a cold before this in 5 years. I hadn't went to the dentist in 10 years. But this was bad enough of a little sore on my leg that I thought, well, shoot, I better keep this covered up and keep some antibiotic cream on it, or else it's gonna get infected. So I kept a bandage over top of it. I thought, shoot, it could be an infected hair. So I tried to pop it for about a week. Nothing would ever come out of it. I kept it covered, and it took it about 3 or 4 weeks before it eventually, the redness and the soreness went away from it. Or not the soreness, but the redness. And it was kind of raised a little bit. I didn't realize that was, at that point, about 3 or 4 days after I'd noticed the bite, so about a week post-bite, that I started having toothaches. And I know that sounds crazy, but I had a toothache, and I thought, well, shoot, I hadn't been to the dentist in a long time, and I chew. So maybe I have a cavity. And it stayed for a day or two, and then it went away, and then this tooth started hurting, and it stayed for a little bit and went away, and then this tooth started hurting, and that was about a 5-day span. And then I woke up one morning, and my hip was so swollen, this is about 2 weeks post-bite, that you could hover your hand over it and feel the heat. It was so swollen and red. Popped a couple ibuprofen, 4 or 5 days went by and it went away. And then about 3 weeks post-bite, my left Achilles tendon swelled up. I stepped off some stairs at work, and I thought I tore my Achilles, it hurt so bad. But chalked it up to your normal wear and tear. And then the week that my son was born, which is about a month or 5 weeks post-bite, we get home, and I had a headache constantly for a week. Didn't go away. Ibuprofen didn't knock it out. Tylenol wouldn't knock it out. But it wasn't like a terrible headache, like clench your face headache. It was just a kind of, it's there. It didn't really hinder me any. And then that morning I woke up with a panic attack. It was about 5.5 to 6 weeks post-bite. So I told the doctor, I said, man, I got bit by a spider. I got bit by a spider probably a month before all this started. And he was like, a spider? And I said, yeah, man, so I rolled up my pant leg, and I would show you guys, but it's barely a scar now, which I still have a scar. It's 7 months later. But at the time, it was probably still about that big around, red. He's like, I think you got bit by a tick, my man. And I said, I never found a tick, and I've always heard about Lyme disease. And honestly, I always hear about it in dogs. We always had dogs and stuff growing up, my uncles. And I always heard dogs get it. I never really thought about a human getting Lyme disease. So he's like, look, I'm going to write you this prescription out for doxycycline. In the meantime, take it. You know, it's not going to hurt you. It can only help you. This Lyme disease test is going to take about a week to get back. So I come home and I throw the prescription in the drawer, and I thought, there's no way that a tick made me this fucking sick. Like, there's absolutely no chance. And a week later, lo and behold, my test came back, not positive, but came back equivocal. But my family doctor, he had said, look, that's enough for me to treat. So he put me on doxycycline, and within the first week, I thought I was dying. My lymph nodes swelled up my armpit and my neck. I mean, I felt like I was dying. I was so weak. It was everything I could do to just go lay in the bathtub and go to sleep. And it progressively got a little bit better as the weeks went on, and 5 or 6 weeks into it, I woke up and about half my shit was gone. So I thought, you know, while I was taking the doxy, I thought, there's still in my head, I'm thinking, there's no way that a tick did this. There's absolutely no way. But then again, you know, the antibiotics help you, so that kind of gives you some reassurance. So I just keep taking the doxy. And it actually got to a point to where my chest from the doxy was getting so sore that I literally could not lay on my belly. I mean, I don't know what the hell that was about. I had a doctor tell me, because I was still going to the ER and to the doctor quite a bit. They were like, oh, it's just costochondritis, you know, this inflammation. But I ended up about a month and a half, 2 months after I took the doxy, I quit the doxy, and I still had, you know, about 50% of my shit left. So I'll start, after I got the Lyme disease diagnosis, you start looking this stuff up, and you see that there's a group of people that get it, and then they stay sick for a really long time, and there's this big debate about whether or not that prolonged antibiotics will help it, or whether or not it's actually an infection after you take the doxycycline, or is it an autoimmune response, so your body's still ramped up and it's causing all these symptoms. But I still had the fatigue, and I still had the muscle twitches all over my body, and my hands and my feet were burning like crazy, and I had sciatic pain all up and down my left leg, and at the time I'd lost like 40 pounds. So I started searching online for different doctors, because I was desperate. You know, I'm barely able to go to work, and I'm doing everything I can do to just make it through a day still yet, you know, and the POTS thing's still there. It's not as bad. Within a month of being on the doxycycline, my heart rate hasn't been below 50 since then. So I find a clinic in Washington, D.C., and we make the 8-hour trip up there. I go see him, and they do this big 4-hour-long examination on me and look, and they tell me that I have all these co-infections, and the doctor there had told me that he suspected that I've had Lyme for a while, and then this new tick bite just pretty much made it worse, which I don't believe that at all. I think that tick bite in July or June absolutely fucked my world up. So I go to them, and I pay like $950 out of pocket, because insurance doesn't cover that. And then I you know, travel expenses. So that was a $1,600 round trip. And when I go, they give me all this big stack of papers and this blood work to get done, and they write me for gabapentin, which is supposed to help calm my nervous system down, and it's also supposed to help with the burning hands and the feet, which it has. But they didn't write me antibiotics. They go about it in a pulsing manner, so they wanted me to take like amoxicillin and azithromycin and Flagyl, and they wanted me to take like 3 days one week, 5 days the next week, and then take a week off. Do that 3 different times. But their issue with it was they felt I was too sick to go through that, so they wanted me to take the gabapentin to calm my nervous system down with some Trilipta, which I refused to take. Long story short, I did that for a month and a half, 2 months. They kept refusing to give me antibiotics, and I'm desperate to get help. Like, I would eat a plate of dog shit every day if it made me feel 100% better. So I have sought treatment elsewhere in Johnson City, Tennessee, and I'm liking this guy pretty good. He started me on the antibiotics, and I'm seeing a little bit of progress, but I definitely feel like Lyme is 100% what's caused all this. If not, the antibiotics wouldn't be helping me. So I'll try to keep everybody updated. The only reason that I even made this video was because I know that I'd go to my YouTube channel and seen some of the comments that people were actually looking me up and had figured out that I had Lyme, and they were like, hey, you should make a video. It might help somebody else. But I tell you guys, like, I would never in a million years imagine that a tick could do this to somebody, but it made me deathly ill, like deathly ill, and I'm still messed up from it, and I don't know. I'm still making steady progress, and I do expect to make a full recovery